Good evening and welcome to our webinar on the leaky gut solution. I'm Dr. Megan Knutson, and tonight I'm going to be talking about, what is leaky gut, what is it caused by, and how you can work on correcting it and reversing it. Before I really get into all of the information tonight, I do want to tell you a little bit about myself. So I'm one of the functional medicine doctors here at Yost Wellness Center. I started my journey going to Truman State University in Kirksville, Missouri. And then from there, I went down to Logan College of Chiropractic and received my doctorate in chiropractic, as well as my master's degree in nutrition and human performance. And so it was really there that I started my journey with functional medicine, gaining all of that knowledge in nutrition. I wanted to continue to dig deeper. And I myself struggled with some hormone imbalance and things like that. And I wanted to really get to the bottom of it and solve it naturally versus, traditionally with, birth control and exogenous hormones. So while I was in school, I found a functional medicine doctor there down in St. Louis and started my journey with him. And, through all of that, changing my diet, supplementation, and a lot of testing, I have been able to get to the root cause of my hormone issues and really make some changes that have really greatly impacted my life. And so after I finished school there, I came back to the Des Moines area. This is where I grew up, actually in Ankeny. And, I wanted to get started and everything right away. So I really started out of school as a chiropractor first, spent a few years solely adjusting, but, I continue to expand my knowledge on nutrition and keep learning about functional medicine, and eventually really decided that that's the path that I needed to follow. And so this has been a really, rewarding journey for me, and it's amazing to see the changes that I do every day in our patients. And it's, not really us doing the work, it's the patients changing their lives. And, we work with a lot of different people, autoimmune conditions, gut problems, leaky gut especially, hormone imbalance and all of that. So that's just a little bit about me. So let's actually jump into our material. So the gut, or your gastrointestinal system, is truly a gateway to overall health. The gut microbiome is an ecosystem of organisms, including things like your bacteria, yeast, fungi, viruses, and protozoan throughout the digestive tract. Far beyond just digestive health, the following organ systems are also closely related to gut health. So you have your immune system, your endocrine system, nervous system, circulatory system, integumentary system, respiratory, and reproductive. So really, when you think about it, that's just about everything. So a few key points to consider: there is 10 times the amount of bacteria in your body than your own cells, and the majority of them are actually found within your digestive system. The gastrointestinal system contains about 90% of the body's happy hormone, serotonin. And then most importantly, approximately 70% of our immune system is actually housed in our gut. So that's majority all laying there in your gut. So as you can tell, gut health doesn't stop at digestion. The health of your gut affects nearly every system of your body. So what is leaky gut exactly? Leaky gut is a term that refers to your intestinal hyperpermeability. And it has become increasingly a more common health problem seen today. Many doctors are seeing more of this. Leaky gut causes major health problems, including autoimmunity. But you're probably wondering, how? How does that actually work? So intestinal hyperpermeability is exactly what it sounds like. The digestive tract is no longer able to ensure the good stays in and the bad stays out. So instead, the tight junctions, or little proteins that hold your intestinal walls together, are actually loosened. And this leaves sizable gaps for undigested food particles, various digestive fluids, and even toxins to enter your bloodstream. So the body reacts to these foreign particles in the blood by producing immune antibodies, or pro-inflammatory cells, to help fight them off. So what happens is this ends up breeding chronic infection, food allergies, and various health complications. So of course, there's no sign of improvement until the gut's permeability is addressed. So this is really the foundation of everything and where we usually start. Fortunately, we now have a better understanding of the causes, obstacles, and treatment methods for leaky gut, so there is a stop to this cycle. So here I have a really great diagram of what leaky gut looks like. So here on the left, this is your normal gut. We have the tight junctions in between each of these cells holding everything together, blocking all of these toxins, microorganisms, gluten, proteins, all of that from entering your bloodstream. Now we see on this right-hand side where leaky gut starts. So we see that the tight junctions have now opened up, allowing for all these big bad things to now leak into the bloodstream. And so what happens, like I said, is an immune response, some kind of pro-inflammatory response. So we have IgG immune responses, IgA, beta, and theta cells are released. So all of these things can then be caused by this leaky gut. So you're probably wondering, how does your gut get leaky? What happens to cause this? So we have found that several factors have negatively affected the gut's integrity. And the most common we found are the standard American diet, pictured here, exposure to various chemicals, chronic infections, gluten and other grains actually causing leaky gut, food allergies, excessive medications, which will break down those tight junctions, and poorly managed stress. So the standard American diet, or the SAD diet, is one of the leading causes of chronic health issues we see today. Actually, according to a 2009 study conducted by the USDA, 63% of the calories Americans are consuming came from processed foods containing preservatives, refined grains, and added sugars and hydrogenated oils. It's almost as though the general public took it upon themselves to refigure the food pyramid to consist of, your traditional food pyramid, if you can picture it, grains at the bottom, dairy in the middle, and sugar at the top, when in all honesty, none of these foods really have any business being part of our diets at all. So you can call it what you want, food, frankenfoods, food-like substances, fake food, but you most definitely can't call most of our food supply real food. When the majority of our diets are packed with meals with paragraph-long ingredients, lists and labels we can't even understand or pronounce, we're not eating real food. Here's a couple of alarming facts that I've actually found. The United States Food and Drug Administration, or the FDA, has approved approximately 3,000 different food additives, preservatives, and colorings without adequate research on safety. And the average person ingests over 150 pounds of additives each year. This is pretty crazy. The magnitude of these chemicals are allowed into our lives is absolutely incomprehensible. We are becoming more and more aware of the consequences from these fake food lifestyles, and it is simply unacceptable. This is the only major factor in the leaky gut epidemic. But it's definitely a big one. It's not the only one, but it's a huge. Up next, we'll be discussing other factors responsible for the onset and progression of leaky gut. So inflammation is a vital immune response and is the body's attempt to defend itself against pathogens, heal yourself from injury, and repair damaged tissue. However, chronic inflammation is not beneficial to our bodies in any way whatsoever. So, in fact, it can actually worsens the body's ability to recognize foreign invaders and then puts the body in a state of stress for extended periods of time. This can cause lasting damage, increased food allergies, and eventually autoimmunities. This type of inflammation can be caused by a number of things, but largely seen as a result of leaky gut syndrome and poor dietary habits. So if chronic inflammation goes untreated, leaky gut is worsened, the body ultimately loses its ability to repair itself from damage, and you end up on this, perpetual hamster wheel going in circles. Gluten is a general term for a mix of proteins in many grains such as wheat, barley, and rye. Gluten has found itself in much of our food supply, disguised in packaged foods and featured in most pre-prepared dishes. It's no surprise that our consumption of gluten has increased immensely and our health is suffering from it. So gluten allergies, sensitivities, and tolerances are becoming increasingly more common, and gluten-free has become kind of a buzzword within the health community, and people are finally beginning to explore how dangerous gluten can actually be for their health. So I'm sure you're wondering, like, how dangerous is it? I've heard a lot about it, but is there really, evidence or everything backing this up? So gluten, it really does actually make your gut leaky. Simple as that. Zonulin, which is a protein found, Zolin, is a protein found in gluten. It actually increases the permeability of the gut by further opening the spaces between cells. The antibodies normally released as a result from leaky gut are accompanied by more antibodies created to attack one of the gluten's more prominent building blocks, gliadin. Now, this leads to more inflammation, more bodily confusion, and even more health complications. So in other words, your body reacts to the consumption of gluten by creating a defense mechanism to fight it, just like it would some kind of infection. And so once this damage has occurred within the digestive tract, it's then distributed throughout the entire body. So it doesn't just stay there, it moves throughout. So aside from contributing, if not entirely causing leaky gut, gluten actually increases inflammation as well, increases overall digestive stress, and alters the balance of your microbiome. So that's all your good bacteria that help to keep your immune system functioning. Our microbiome must be equipped with efficient, healthy bacteria in order to be successful and carry out its necessary functions. So without that proper balance of bacteria, the following things are disrupted. Of course, your digestion overall, but immune response, nutrient absorption, hormone regulation, vitamin production, detoxification, mood management, and many more that aren't listed here. So gluten produces both primary and secondary effects. The damage gluten causes that we have talked about thus far is mostly been primary. And so these included the intestinal hyperpermeability or leaky gut, the permeability of your blood-brain barrier, onset of autoimmune diseases such as like celiac, Crohn's, ulcerative colitis are all in that category, the development of psychological disorders, dysbiosis or abnormal bacterial growth, acute allergic or IgG or IgE responses, those would be like your anaphylaxis, and then delayed antibody response. So while all of these issues are very serious within themselves, they too cause further complications. So next come the secondary effects of gluten. So the secondary effects would include things like severe nutrient deficiencies, like iron or B12, both very, very common, and then systemic inflammation, which over time leads to organ and tissue breakdown. So it may seem a bit redundant that we keep coming back to how our body acts to gluten, but it's one of the most important pieces of information you can take away from this class. Gluten is a major component in the leaky gut cycle. It's present in the onset, the maintenance, and the progression of this damaging condition and should not be taken lightly. So as you can probably guess, gluten's path to disease is pretty direct. The first step is when gluten's contribution goes unnoticed. At this point, it's likely there's little to no symptoms. This is where most people will assume that gluten won't hurt them, and therefore they can eat it with no problem. Unfortunately, the lack of apparent symptoms does not mean that gluten doesn't hurt your gut. In fact, it takes exposure over time and the accumulation of damage before the leaky gut will be noticeable. So for those cutting out gluten before they feel physical discomfort, they're still treating an underlying issue even if they can't quite feel it yet. The next step in the progression is subclinical problems. So this is where leaky gut truly begins to develop. Often the first things that will be noticed is an increased food or environmental allergies. So digestive distress may begin to become more frequent as well. Unfortunately, this is common for people to still avoid blaming gluten for this discomfort, and they think it's just related to something they ate, something different, they ate some bad food. So the last step in recognizing this problem, it's not usually recognizing gluten as the problem, but the acknowledgement of the problem that gluten has caused. For example, like if someone is diagnosed with a chronic disease or develops inflammatory changes, most medical doctors will begin treating these conditions rather than examining the origin. So it's really a shame that this happens so often, as if gluten was recognized as the main problem during the early stages, then a lot of these health conditions would be avoided entirely. Gluten, however, is not the only concern when it comes to solving leaky gut, so we'll be going over other issues that contribute to this dangerous syndrome in a moment. So much like the additives and preservatives flooding our food supply, pesticides are also a big part of what's on our plates. There are 3 million tons of pesticides used worldwide each year, and more than 16,000 chemicals involved in the production of these pesticides. Studies to ensure their safety on humans have been very limited, whereas some have no documented research at all. This absolutely blows my mind. So while we're not entirely sure of their safety on human health, we do recognize strong links between pesticide exposure and things like nervous system disorders, immune system suppression, reproductive damage, hormonal imbalances, thyroid issues, type 2 diabetes, obesity, even asthma or migraine headaches, various attention disorders, and developmental delay in children. So the magnitude that pesticides, along with steroids, hormones, antibiotics, and excitotoxins show up in our food supply is truly frightening. And to think that it isn't a main component of our leaky gut trend is simply impossible. So medication is severely overprescribed in the current medical model used today. Medical programs train doctors to medicate symptoms even when they're unsure of the cause. And this, in short term, really has seemed to work because the patient's experience is temporary relief from their discomfort. So, they think it works because temporarily they're feeling better. But what isn't taken into account is how these excessive prescriptions have actually affected our bodies. For example, statins, drugs used to usually lower cholesterol, have shown to lower vitamin D and CoQ10 levels. While it may be lowering cholesterol, it is simultaneously causing nutrient deficiencies, muscle fatigue, increased blood pressure, and a weakened immune system. Painkillers like ibuprofen, naproxen, or aspirin can contribute to vitamin C and iron deficiencies, leaving one really vulnerable to disease and eroding your mucosal lining of your stomach. Acid reduction medications end up hindering the digestion of your protein, calcium, and even vitamin B12, often causing chronic pain problems. And long-term uses of antidepressants, too, significantly lower the gut's motility, causing digestive issues. And then lastly, it's important to note that almost all medications are unable to differentiate between the good bacteria in our gut and the illness that they're trying to attack. So this results in altered microbiome and a much greater risk of infections when exposed to many rounds of antibiotics and things like that. So as you can tell, drugs offer a lot of unintended consequences that can affect our health very badly. There are very few situations where drugs should be your solution, such as life-threatening infections, of course, or surgical situations. And without the immediate emergency needs of medication, it is best to treat the issue than it is to temporarily patch up the problem. So our gut has 5 critical elements, or defenses, that it truly needs for healthy gut function. So in order from most outer layer of defense, they include your mucosal IgA, otherwise known as immunoglobulin A. This antibody is found in the mucous membranes and is considered your gut's first line of defense against various toxins. Second would be tight junctions. So I've mentioned these earlier. These are the little small proteins that are responsible for holding your gut cells together. And this is what is most directly affected in leaky gut syndrome. Third, we have your gastro-associated lymphoid tissue. This is abbreviated to GALT, G-A-L-T. And this is your gut's concentrated immune system. And in fact, actually 70% of our immune system altogether. So this is the gut's last and most powerful layer of defense that we have. And so the gut's accessory defense includes your friendly good bacteria. And as we mentioned, we have more bacteria in our bodies than we do our own cells, which is so crazy. This bacteria can actually communicate with that GALT, warning it of potential danger. And then we also have our stomach acid. So this is absolutely essential for digestion, absorption of nutrients, and your defense against infections. So if there's any dysfunction throughout your gut's line of defense in any of these 5, they need to be evaluated in order to heal and then be treated properly. So where do we start in treatment here? You know, what do we need to do first? So the first steps of healing is ruling out the fundamental causes of leaky gut. It's important to recognize that it's very rarely only one cause. Usually it's a combination. And we must first rule out or begin to recognize the following. So firstly, like vitamin deficiencies by functional nutrition testing, infectious pathogens by blood or GI tract tests. So we often use stool testing here in the office, a GI map test. Also looking into heavy metal toxicity by urine or hair testing, gluten sensitivity testing, and then environmental allergies or skin or blood tests here, also looking into food sensitivities. So if any of these come back positive, you have to first start with addressing these deficiencies, changing the diet, limiting exposure to allergens or sensitivities, and then considering detoxing and clearing everything out. So once you have a better understanding of your body's unique needs, you can then begin to form a functional medicine protocol, and we call this the 4Rs. So the 4R program is administered to help you heal from digestive distress. So reverse gut complications and rebalance your gastrointestinal microbiome. It's an incredible tool to acknowledge and treat health issues, dysfunctions, imbalances, and personal health needs. So it's done in this order. First, remove. So we need to eliminate problem foods, toxins, infections, and oxidative stress. Second is to repair. So we begin reintroducing a clean diet with essential nutrients that your body really needs. Third is restoring. So we need to repopulate your gut with healthy bacteria to restore the proper balance of gut flora. And then replacing. So we need to replace digestive enzymes, antioxidants, immune-boosting vitamins to help promote sustainable and healthy digestion. So we as functional medicine practitioners, we're trained in this protocol and enthusiastic about making sure that your individual needs are addressed during this process. So like I said, we start by removing the bad. So at this point, you may have already removed things you already knew were to be detrimental to your health, such as gluten and known allergies. But you also want to remove much of the chemical burden in your daily life. So this includes, as we talked about earlier, pesticides, genetically modified organisms, unnecessary medications, and unnatural household cleaners. Our last 3 steps here. So once you have an understanding of what should be removed from your daily life and you begin to implement those changes, it's time to then begin repairing the damage that has previously been done. This is done by calming the chronic inflammation and reintroducing nutritious foods, digestive enzymes, probiotics, essential fiber, vitamins, minerals, acids, and all of that good stuff. For some people, these steps may mean implementing intermittent fasting, supplementation for some of this, or diet plans that cater to their specific health needs. So again, you want to be sure to consult with, a functional medicine practitioner to be sure that you're beginning the most appropriate repair route for your needs. Everyone is very different. So for supplementation, nutrients must be replaced for effective healing. While everyone's needs are highly individualized, here are some common supplements that have been proven to be helpful in gut healing. Of course, we have probiotics and prebiotics, various digestive enzymes, fiber, collagen, turmeric, L-glutamine, and quercetin. But again, you want to go through the proper testing to figure out what you need, because guessing could end up getting you into more trouble in reality. So we have a saying in our office: we test, we don't guess, to know exactly what each and every individual needs. And again, these are only suggestions, like I said, so you need that testing to know what exactly you're going to need. So the main takeaway really from this is that you should not rely solely on supplements either. They can be used to help your healing process, but the goal is to be able to sustain wellness with whole foods and a healthy lifestyle choice long term without the need for piles of pills. Supplementation should never be a very long term or lifelong thing. So what can you do to help maintain, once you have healed your gut and things are working properly, how can you maintain this? And the most difficult part of health is maintaining it, honestly. So even if you build a strong foundation during the healing process, without the proper diet, lifestyle choice and stress management long term, you can fall right back to the same gut destroying patterns. So remember, health is a journey, not a destination. Although there is plenty of research on the dangers of leaky gut, it's still considered a medical mystery. Many cases go misdiagnosed and in turn aren't properly treated. So it's crucial to work with your doctor familiar with the condition, so they can perform like I said, the proper tests in order for you to heal effectively and efficiently. So you always start with the fundamentals, honor your body's unique needs, and skip the guesswork. Thank you so much for taking the time to experience this class. We love sharing this topic with people who are eager to transform their health, and this group is just fantastic. So if you have any questions, please don't hesitate to reach out and let us know. We're always here to support you. And please, share this information if you know someone that could benefit. And two, if following the webinar, if you feel like, this is something I want to investigate, or this sounds a lot like me, or I just want more information, please give our office a call here at 515-278-4325, or you can always email us at info@yostwellnesscenter.com. Consultations in our office are always free of charge. So if you just want more information, or you just want to, ask more questions, please don't hesitate to reach out.